Hello from your student dentistas. Do you know what is the head and its formation? Head is formed mainly by the skull with the brain, and it's covering meninges enclosed in the cranial cavity. It has special senses, the eye and the ear, which lies within the skull bones. Here is a simple presentation of the skull. Looks familiar, doesn't it? As this is what we usually see in movies. We have here is the skull in its anterior view. There are several bones that comprises the skull, namely the optic canal, orbital plate, frontal, coronal suture, frontal zygomatic suture, zygomatic, superior and inferior orbital fissure, zygomatico-maxillary suture, middle and inferior concha, the maxilla, ramus of mandible, mastoid process, infraorbital foramen, zygomatic, squamous temporal, zygomatic process of frontal, greater wing of sphenoid, parietal, supraorbital notch, superciliary arc, frontal process of maxilla, nasal, frontal, and lastly, the lacrimal. Now, as I mentioned in the previous slide, we shall explore and learn the different parts of the brain. This is what the brain looks like if viewed anteriorly. Here, we'll see the central sulcus, sensory area, parietal lobe, parieto-occipital sulcus, occipital lobe, visual area, supratemporal gyrus, cerebellum, medulla oblongata, pons, auditory area, temporal lobe, lateral sulcus, motor speech area, frontal lobe, premotor area, and lastly the motor area. Next, here we see is the posterior and superior view of the skull. The lines that we see is what we call suture. The suture called in this area is the sagittal suture. Next is the parieto-mastoid suture on this part. And next is the lambdoid suture. That's the different sutures we see on the posterior view. The other parts are the occipital, the mandible below, styloid process on this area right here, mastoid process, superior neutral line, external occipital protuberance, the inferior and superior temporal line, and lastly, the parietal bone. Now, as for the superior view, we have here the nasal, frontal bone, coronal suture, sagittal suture, parietal bone, and the lambdoid suture. Next up is the lateral view of the skull. This is what the skull looks like on the side. As we can see, there are more parts on this area than we saw on the last slides. Here, let us name each part there is. First, here we see is the parietal supramastoid crest, lambdoid suture, occipital, external occipital protuberance, superior neutral line, suprameatal triangle and spine, external or auditory meatus, tympanic plate, mastoid process, styloid process, head of mandible, the neck of mandible, angle, ramus, body of mandible, mental foramen, alveolar part, maxilla, coronoid process, infraorbital foramen, zygomaticofacial foramen, zygomatic, lacrimal, frontal process of zygomatic, nasal, nasion, zygomatic process of frontal, greater wing of sphenoid, frontal, temporal lines, coronal suture, pterion, which is an important area by the way because it overlies the interior division of the middle meningeal artery and vein. Next is zygoma, and the last is squamous temporal. Next is the coronal section through the body of the sphenoid, showing the hypophysis cerebri and cavernous sinuses. Note the position of the cranial nerves, which are the hypophysis cerebri, diaphragma cellae, cavernous sinus, oculomotor nerve, trochlear nerve, ophthalmic nerve, maxillary nerve, abducent nerve, cavity of nose, internal carotid artery, sphenoidal sinus, and nerve of the pterygoid canal. Here we see the hypophysis cerebri, anterior clinoid process, diaphragma cellae, dorsum cellae, oculomotor nerve, tentorium cerebelli, trochlear nerve, tegmentum, tentorial notch, superior colliculus, cerebral aqueduct, substantia nigra, crus cerebri, posterior cerebral artery, superior cerebellar artery, posterior communicating artery, internal carotid artery, ophthalmic artery, optic nerve, olfactory tract, and olfactory bulb. The forebrain has been removed, leaving the midbrain, the hypophysis cerebri, and the internal carotid and basilar arteries in position. The sagittal section through the sala turcica shows the hypophysis cerebri. These are its parts: infundibulum, tuberous cinerarium, posterior lobe, posterior cerebral artery, body of sphenoid, basilar artery, sphenoidal sinus, and anterior lobe. This view of the skull looks enigmatic, scary even, but this is the inferior view of the base of the skull. Here we see the different parts that we can see from the inferior view. These parts are the incisive foramen, palatal process of maxilla, tubercle of maxilla, zygomatic arc, humulus, infratemporal crest, scaphoid fossa, mandibular fossa, articular tubercle, hypoglossal canal, styloid process, squamous part of temporal bone, stylomastoid process, mastoid process, pharyngeal tubercle, foramen magnum, supernuchal line, occipital bone, external occipital protuberance, condyle, jugular foramen, carotid canal, tympanic part of temporal bone, petrous part of temporal bone, spinal sphenoid, foramen spinosum, foramen ovale, medial pterygoid plate, lateral pterygoid plate, vomer, lesser palatine foramen, greater palatine foramen, inferior orbital fissure, and palatal process of palatine. Now, this is the internal surface of the base of the skull. These are the crista galli, lesser wing of sphenoid, tuberculum sillae, sala turcica, posterior clinoid process, dorsum sillae, hiatus for greater petrosal nerve, arcuate eminence, groove for superior petrosal sinus, jugular foramen, basilar part of occipital, foramen magnum, internal occipital crest, internal occipital protuberance, hypoglossal canal, groove for transverse sinus, groove for sigmoid sinus, internal acoustic meatus, petrous part of temporal, squamous part of temporal, foramen spinosum, groove for middle meningeal artery, foramen ovale, foramen lacerum, foramen rotundulum, anterior clinoid process, optic canal, orbital plate of frontal, cribriform plate, and foramen cecum. Our cranial cavity houses the brain and other vital nerves, arteries, veins, and venous sinuses. The base of the skull is being divided into three cranial fossae: the anterior, which is separated from the middle cranial fossa by the lesser wing of the sphenoid. Next is the middle, that is separated from the posterior cranial fossa by the petrous part of the temporal bone. And last is the posterior parts. Next, we are to discuss is the anterior and cranial fossa, which is anterior laterally located by the frontal bone, inferior to the orbital plates, anteriorly located to the body of the sphenoid, medially by the cerebrum plate of the ethmoid bone, and is posteriorly located by the lesser wing of the sphenoid bone. The middle and posterior fossa, the middle fossa, is medially narrow and laterally widens to the sides of the skull. The clivus and the petrous crest separate the middle fossa from the posterior fossa. The aforementioned posterior fossa is a tiny space in the cranium or skull. It is found near the brainstem and the cerebellum, which is a part of the brain that we'll encounter later on in the next slides. The brain is surrounded by three meninges, which is namely the dura mater, arachnoid mater, and the pia mater. The dura mater has two layers, the endosteel layer and the meningeal layer. The endosteel layer is an ordinary periosteum covering the inner surface of the skull bones. It continues to the dura mater of the spinal cord. It continues with the periosteum on the outside of the skull bones around the margin of the foramina of the skull. The other layer is the meningeal layer, which is considered as the dura mater proper. It is a fibrous membrane that covers the brain that is strong and dense. It continues through the foramen magnum to the dura mater on the spinal cord. And for the last topic for our head, next up here is the muscle of the scalp. We can see here, these are the different muscles that comprises the scalp.
Hello everyone, welcome to the orbital region. The orbits are a pair of bony cavities that contain the eyeballs. They are associated with muscles, nerves, vessels, and fat, and most of the lacrimal apparatus. The orbital opening is guarded by the two thin, movable folds and the eyelids. Let's go to the eyelids. The eyelids protect the eye from injury and excessive light by their closure. The upper eyelid is larger and more movable or mobile than the lower. They meet each other at the medial and lateral angles. The palpebral fissure is the elliptical opening between the eyelids and is the entrance into the conjunctival sac. When the eye is open and looking straight ahead, the upper lid just covers the upper margin of the cornea. The lower lid lies just below the cornea. When the eye is open and rises only slightly when the eye is closed, superficial surface of the eyelids is covered by the skin, and the deep surface is covered by a mucous membrane called the conjunctiva. The eyelashes are short, curved hairs on the free edges of the eyelids. They are arranged in double or triple rows at the mucocutaneous junction. The sebaceous glands open directly into the eyelash follicles. In the picture labeled letter A, the right eye with the eyelids separated to show the openings of the tarsal glands, plica semilunaris, caronocula lacrimalis, and puncta lacrimalis. In the picture letter B, the left eye showing the superior and inferior tarsal plates and the lacrimal gland, sac, and duct. And on the letter C, sagittal sections through the upper eyelid and the superior fornix of the conjunctiva. Note the presence of the smooth muscles in the levator palpebrae superioris. The more rounded angle is separated from the eyeball by a small space, the lacus lacrimalis, in the center of which is a small reddish yellow elevation, the caruncula lacrimalis. A reddish semilunar fold called the plica semilunaris lies on the lateral side of the caruncle. Near the medial angle of the eye, a small elevation, the papilla lacrimalis, is present. The names of the structures seen in the examination of the eye. The framework of the eyelids is formed by a fibrous sheet, the orbital septum. This is attached to the periosteum at the orbital margins. The orbital septum is thickened at the margins of the eyelids to form the superior and inferior tarsal plates. Let's go to the movements of eyelids. The position of the eyelids at rest depends on the tone of the orbicularis oculi and the levator palpebrae superioris muscles, and the position of the eyeball. The eyelids are closed by the contraction of the orbicularis oculi and the relaxation of the levator palpebrae superioris muscles. The orbit is a pyramidal cavity with its base anterior and its apex posterior. The orbital margin is formed above by the frontal bone. The lateral margin is formed by the processes of the frontal and zygomatic bones. The inferior margin is formed by the zygomatic bone and the maxilla, and the medial margin is formed by the processes of the maxilla and the frontal bone. Let's go to the orbit. In the picture letter A, the right eyeball exposed from in front. In letter B, muscles and nerves of the left orbit as seen from in front. In letter C, bones forms the walls of the right orbit. In letter D, the optical canal and the superior and inferior orbital fissures on the left side. The roof of the orbit is formed by the orbital plate of the frontal bone, which separates the orbital cavity from the anterior cranial fossa and the frontal lobe of the cerebral hemisphere. And then we have the lateral wall formed by the zygomatic bone and the greater wing of the sphenoid. The floor is formed by the orbital plate of the maxilla, which separates the orbital cavity from the maxillary sinus. And the medial wall is formed from before backward by the frontal process of the maxilla, the lacrimal bone, the orbital plate of the ethmoid, and the body of the sphenoid. Muscles and nerves of the right orbit viewed from the lateral side. The maxillary nerve and the pterygopalatine ganglion are also shown. Orbital fascia. The orbital fascia is the periosteum of the bones that form the walls of the orbit. It is loosely attached to the bones and is continuous through the foramina and fissures with the periosteum covering the outer surface of the bones. Let us move on to the next topic, the nerves of the orbit. The nerves of the orbit enters the orbit from the middle cranial fossa by passing through the optic canal. It is accompanied by the ophthalmic artery, which lies on its lower lateral side. The nerve is surrounded by sheets of pia mater, the arachnoid mater, and the dura mater. Right and left orbital cavities viewed from above. The roof of orbit, formed by the orbital plate of the frontal bone, has been removed from both sides. On the left side, the levator palpebrae superioris and the superior rectus muscles have also been removed to expose the underlying structures. Here, the meninges fuse with the sclera so that the subarachnoid space with its contained cerebral spinal fluid extends forward from the middle cranial fossa, around the optical nerve and through the optic canal as far as the eyeballs. The lacrimal nerve arises from the ophthalmic division of the trigeminal nerve. It enters the orbit through the upper part of the superior orbit fissure and passes forward along the upper border of the lateral rectus muscle. The next one is the frontal nerve arises from the ophthalmic division of the trigeminal nerve. It enters the orbit through the upper part of the superior orbital fissure and passes forward on the upper surface of the levator palpebrae superioris beneath the roof of the orbit. Trochlear nerve enters the orbit through the upper part of the superior orbital fissure. It runs forward and supplies the superior oblique muscle. The superior ramus of oculomotor nerve enters the orbit through the lower part of the superior orbital fissure. It supplies the superior rectus muscle, then pierces it and supplies the levator palpebrae superioris muscle. The nasociliary nerve arises from the ophthalmic division of the trigeminal nerve. It enters the orbit through the lower part of the superior orbital fissure. The abducens nerve enters the orbit through the lower part of the superior orbital fissure. It supplies the lateral rectus muscle. The ciliary ganglion is a parasympathetic ganglion about the size of a pinhead and situated in the posterior part of the orbit. It receives its preganglionic parasympathetic fibers from the oculomotor nerve via the nerve to the inferior oblique. Let's proceed to the windows of the soul, the eyes. Movements of the eyeball, terms used in describing the eye movements. The center of the cornea or the center of the pupil is used as the anatomic anterior pole of the eye. All movements of the eye are then related to the direction of the movement of the anterior pole as it rotates on any one of the three axes: the horizontal, vertical, and sagittal. Muscles of the eye are the extrinsic muscles that produce the movement of the eye and the involuntary intrinsic muscles. There are 6 voluntary muscles that run from the posterior wall of the orbital cavity to the eyeball. These are the superior rectus, the inferior rectus, the medial rectus, the lateral rectus, and the superior and inferior oblique muscles. The involuntary intrinsic muscles are the ciliary muscle and the constrictor, and the dilator papillae of the iris take no part of the movement of the eyeball and are discussed later. Facial sheath of the eyeball. It surrounds the eyeball from the optic nerve to the corneoscleral junction. It separates the eyeball from the orbital fat and provides it with a socket for free movement. It is perforated by the tendons of the orbital muscles and is reflected onto each of them as a tubular sheath. Structure of the eye. The eyeball is embedded in the orbital fat but is separated from it by the facial sheath of the eyeball. The eyeball consists of 3 coats, which, from without inward, are the fibrous coat, the vascular pigmented coat, and the nervous coat. Did you know what the coats of the eyeball? First, the fibrous coat is made up of the posterior opaque part, the sclera, and the anterior transparent part, the cornea. Then the opaque sclera is composed of dense fibrous tissue and is white. Posteriorly, it is pierced by the optic nerve and is fused with the dorsal sheath of the nerve. The sclera is also pierced by the ciliary arteries and nerves, and their associated veins, the venae verticosae. Then the cornea. The transparent cornea is largely responsible for the refraction of the light entering the eye. The blood supply of the cornea is avascular and devoid of lymphatic drainage. It is nourished by the diffusion from the aqueous humor and from the capillaries at the edge. The nerve supply of the cornea is long ciliary nerves from the ophthalmic division of the trigeminal nerve. The function of the cornea is the most important refractive medium of the eye. This refractive power occurs on the anterior surface of the cornea, where the refractive index of the cornea differs greatly from that of the ear. The retina consists of the outer pigmented layer and the inner nervous layer. Its outer surface is in contact with the choroid and its inner surface is in contact with the vitreous body. The posterior 3/4 of the retina is the receptor organ. Its anterior edge forms a wavy ring, the ora serrata, and the nervous tissue ends here. The contents of the eyeball consist of the refractive media, the aqueous humor, the vitreous body, and the lens. The ear consists of the external ear, the middle ear or tympanic cavity, and the internal ear or the labyrinth, which contains the organs of hearing and balance. The external ear has an auricle and external auditory meatus. The auricle has a characteristic shape and collects air vibrations. It consists of a thin plate of elastic cartilage covered by skin. It possesses both extrinsic and intrinsic muscles, which are supplied by the facial nerve. The picture letter A are the different parts of the auricle of the external ear. The arrow indicates the direction of the auricle should be pulled to straighten the external auditory meatus before insertion of the otoscope in the adult. In picture letter B, the external and middle portions of the right ear are viewed from in front. And in the picture letter C, the right tympanic membrane as seen through the otoscope. Here is another picture. In letter A, parts of the right ear in relation to the temporal bone viewed from above. And letter B, the auditory ossicles. The meatus is lined by the skin, and its outer third is provided with hairs and sebaceous and ceraminous glands. The latter are modified sweat glands that secrete a yellow-brown wax. The hairs and wax provide a sticky barrier that prevents the entrance of the foreign bodies. The sensory nerve of the lining skin is derived from the auriculotemporal nerve and the auricle branch of the vagus nerve. The middle ear is an air-containing cavity in the vitreous part of the temporal bone and is lined with mucous membrane. It contains the auditory ossicles, which function is to transmit the vibrations of the tympanic membrane or the eardrum to the perilymph of the internal ear. It is a narrow, oblique, slit-like cavity whose long axis lies approximately parallel to the plane of the tympanic membrane. It communicates in front through the auditory tube with the nasopharynx and behind with the mastoid antrum. The middle ear has a roof, floor, anterior wall, posterior wall, lateral wall, and medial wall. Here is another picture. In picture letter A, the lateral wall of the right middle ear viewed from the medial side. Note the position of the ossicles and the mastoid antrum. In letter B, medial of the right middle ear viewed from the lateral side. Note the position of the facial nerve and its bony canal. The medial wall is formed by the lateral wall of the inner ear. The greater part of the wall shows a rounded projection called the promontory, which results from the underlying first turn of the cochlea. Above and behind the promontory lies the fenestra vestibuli, which is oval shaped and closed by the base of the stapes. The auditory ossicles are the malleus, incus, and the stapes. The malleus is the largest ossicle and possesses a head, a neck, a long process or handle, and anterior process and lateral process. The mandible or lower jaw. It is the largest and strongest bone of the face, and it articulates with the skull at the temporomandibular joint. The mandible consists of horseshoe-shaped body and pair of rami. The body of mandible on its external surface in the middle has a faint ridge indicating the line of fusion of two halves during development at symphysis manti. The mental foramen can be seen below the second premolar tooth. It transmitted the terminal branches of the inferior alveolar nerve and vessels. The temporomandibular joint is seen from the lateral and medial aspects. The coronoid process receives on its medial surface the attachment of the temporalis muscle. Temporomandibular joint. Articulation occurs between the articular tubercle and the anterior portion of the mandibular fossa of the temporal bone above, and the head or the condyloid process of the mandible below. The articular surface are covered by fibrocartilage. Type of joint. The temporomandibular joint is synovial. The articular disc divides the joint into the upper and lower cavities. Temporomandibular joint with mouth closed and with the mouth open. Note the position of head, the mandible, and articular disc in their relation to the articular tubercle in each case. The attachment of muscles of mastication to the mandible. The arrows indicate the direction of their actions. The capsule surrounds the joint and is attached above the articular tubercle and margins of the mandibular fossa and below the neck of the mandible. The lateral temporomandibular ligament. It strengthens the lateral aspect of the capsule and its fibers run down and backward from the tubercle on the root of the zygoma to the lateral surface of the neck of the mandible. This ligament limits the movement of the mandible in the posterior direction and thus protects the external auditory meatus. Synovial membrane. This lines the capsule of the upper and lower cavities of the joint. The nerve supply are the auriculotemporal and mesenteric branch of the mandibular nerve. The movements of the mandible can be depressed or elevated, protruded or retracted. Rotation can also occur, as in chewing. In the position of rest, the teeth of the upper and lower jaws are slightly apart. On closure of the jaws and the teeth come into contact.
Hello again! In this slide, we will tackle about the face of the head and vertebrae that contains the eyes, nose, mouth, and jaws. It spans from the forehead to the chin in humans. The face contains skin and numerous sweat and sebaceous glands. It is attached to the underlying bones by loose connective tissue, which contains the face muscles. No deep fascia is present in the face. Face wrinkles are recurrent skin folding perpendicular to the long axis of the contracting muscles, plus a loss of youthful skin suppleness. Face surgery scars are less noticeable if they follow wrinkle lines. Here's a trivia about the skin. Did you know an inch of skin contains 19 million cells and 300 sweat glands? Next, skin is the thickest on feet, 1.4 millimeters, and the thinnest on eyelids, 0.1 millimeter and 0.2 millimeter. Skin reintegrates every 28 days. Your skin sheds 30,000 to 40,000 dead cells per minute. Wow, that's a lot. For the sensory nerves of the face, the trigeminal nerve, except for the small area over the angle of the mandible and the parotid gland, which is supplied by the great articular nerve, C2 and 3. As what we've seen in the picture, letter A in the first right side of the face represents the sensory nerve supply to the skin of the face that contains 12 nerves. The supratrochlear, infratracheal, supraorbital, lacrimal, zygomaticotemporal, auriculotemporal, zygomaticofacial, infraorbital, external nasal, buccal, great auricle, and the mental nerve. Letter B on the first left side of the face are the branches of the 7th cranial nerve, 2 muscles of facial expression, the temporal, zygomatic, buccal, zygomatic, mandibular, and cervical branch. For letter C, second right side of the face are the arterial supply of the face, supratrochlear, supraorbital, superficial temporal, zygomaticotemporal, lacrimal, zygomaticofacial, infraorbital, transverse facial, external nasal, facial, mental, and external carotid artery.
The three major branches of trigeminal nerve are the ophthalmic nerve, auxiliary, and mandibular nerve. As you can see, at the left part, we see trigeminal ganglion, trigeminal nerve, auriculotemporal nerve, mandibular division, inferior alveolar nerve, lingual nerve, myeloid nerve, inferior alveolar nerve, lingual nerve, superior alveolar nerves, maxillary nerve, infraorbital nerve, nasociliary nerve, lacrimal nerve, frontal nerve, and ophthalmic division. These nerves provide proprioceptive fibers to the underlying muscles of the facial expression. They also supply the mouth, teeth, nasal cavities, and paranasal air sinuses. As you can see in the letter A, arrangement of the facial muscles around the lips is first is the mentalis, depressor labii inferioris, depressor anguli labii, platysma, orbicular oris, risorius, zygomaticus major, levator anguli oris, zygomaticus minor, levator labii superioris, levator labii superioris, alakinasi. At the letter B, the sensory nerve supply of the lips. First is the mental nerve, which is V3, then the infraorbital nerve V2 and buccal nerve V3.
Let's move on to the bones of the face. The frontal bone, which houses superior orbital borders and the area above them. The zygomatic bone forms the lateral orbital margin, whereas the zygomatic bone and the maxilla create the inferior orbital margin. Above the maxillary process of the frontal bone and below the frontal process of the maxilla, the medial orbital margin is produced. The nasal bones, which connect below with the maxilla and above the frontal bones, form the nose's root. Upper and lower hyaline cartilage plates, as well as tiny cartilages of the ala nasi, complete the nose from the front. The maxilla, which houses the teeth and the maxillary air sinus, is an important central bone in the middle third of the face. The mandible is the bone in the lower portion of the face that houses the teeth. The bones of the face are discussed in greater detail in the topic of the skull. In this illustration, we can see that in letter A are the bones of the front of the skull: the frontal ethmoid, parietal, lesser wing of sphenoid, greater wing of sphenoid, squamous temporal, lacrimal, zygomatic, mastoid process, nasal, maxilla, and the mandible. As we can see in the other half of the face, it contains the 5 lymph drainage of the face: parotid, buccal, submandibular, deep cervical, and submental nodes. Next is the muscles of the eyelids. The orbicularis oculi is the eyelid sphincter muscle, whereas the levator palpebrae superiosus and occipital frontalis are the dilator muscles. Third, we have the muscles of the nostril. The compressor naris is the sphincter muscle, while the dilator naris is the dilator naris. Fourth and last, muscles of the cheeks and lips. The orbicularis oris is the sphincter muscle. A collection of tiny muscles that radiates out from the lips make up the dilator muscles. Okay, let's move forward in discussing about the specific muscle's origin, insertion, nerve supply, and action. First is the sphincter muscle of the lips, or orbicularis oris. Origin and insertion. The fibers encircle the oral orifice within the substance of the lips. The maxilla and mandible both have fibers at the midline. Other fibers emerge from the skin's deep surface and converge on the mucous membrane lining the lips' inner surface. The buccinator muscle provides many of the fibers. The nerve supply. Buccal and mandibular branches of the facial nerve. Action: compresses the lips together. Second, dilator muscles of the lips. The dilator muscles radiate from the lips and function to split the lips, frequently accompanied by jaw separation. The muscles originate from the bones and fascia surrounding the oral aperture and insert into the lip material. Trace from the side of the nose to the angle of the mouth and then below the oral aperture. The muscles are named as follows: levator labii superioris olechinasi, levator labii superioris, zygomaticus minor, zygomaticus major, levator anguli oris, which is deep to the zygomatic muscles, risorius, depressor anguli oris, depressor labii inferioris, and mentalis. Next is the nerve supply. Buccal and mandibular branches of the facial nerve. The first two muscles discussed was specifically about the muscles of the lips, and this one tackles about the muscle of the cheek, the bigunator. The first two muscles discussed was specifically about the muscles of the lips, and this one tackles about the muscle of the cheek, the bigunator. Origin: the pterygomandibular ligament and the outside surface of the alveolar borders of the maxilla and mandible opposite the molar teeth. Its insertion: the muscle fibers constitute the cheek's muscle layer. The parotid duct pierces the muscle. The highest and lowest fibers continue into the upper and lower lips, respectively, without crossing. The bigunator muscle merges with the orbicularis oris muscle. The nerve supply. Buccal branch of the facial nerve. Its action: compresses the cheeks and lips against the teeth. For the last topic related to the face, introducing the facial nerve. As the facial nerve runs forward, the substance of the parotid salivary gland, it divides into its 5 terminal branches. First is the temporal branch, which supplies the anterior and superior auricle muscles, the occipitofrontalis frontal belly, orbicularis oculi, and corrugator supercilii. Second is the orbicularis oculi is supplied by the zygomatic branch, which arises from the glans anterior border. Third is the buccal branch, which arises from the glans anterior border behind the parotid duct, supplies the buccinator muscle, as well as the upper lip and nostril muscles. Fourth, we have the mandibular branch, which emerges from the glans anterior edge and supports the lower lip muscles. Last is the cervical branch, that arises from the glans lower border and travels forward in the neck, below the mandible, to supply the plastoma muscle. Facial nerve is the second pharyngeal arc nerve that supplies all facial expression muscles. Although it does not serve the skin, its branches connects with the trigeminal nerve's branches. Whew, that was a lot of words. Struggle to remember the 5 branches of the facial nerve? Well, remember the 10 zebras bugged my car. 10. T for temporal, zebras, Z for zygomatic, buggered, B, buccal, my, M for mandibular, and lastly car, C for cervical.
Parts of the neck. Now let's talk about the neck. So the neck is the region of the body between the lower margin of the mandible above and the suprasternal notch of the upper border of the clavicle below. The cervical section of the spinal column, which is convex forward and supports the head and strengthens the neck. A large set of extensor muscle lies behind the vertebrae, whereas a small group of flexor muscles lies in front. Sections of respiratory system, such as the larynx, are located in the middle of the region, while parts of alimentary system, such as pharynx and esophagus, are located behind. The carotid arteries, internal jugular veins, vagus nerve, and deep cervical lymph nodes run vertically on the either side of the these structures. So this is the cervical spine, often known as the neck. It's a complex system made up of nerves, muscles, ligaments, and tendons. The cervical spine is both fragile and strong and flexible, allowing the neck to move all around directions. It houses the spinal cord, which delivers information from the brain to regulate all elements of the body. According to the article Cervical Spine Anatomy by Salazar MD, stating the cervical spine performs several crucial roles, including protecting the spinal cord, supporting the head and its movements, and facilitating flow of the blood to the brain. Let me show you the general anatomy of the neck. As we can see in the picture, there is the parietal bone, temporal fossa, external acoustic meatus, styloid process, mystoid process, stylomandibular ligament, stylohyoid ligament, angle of mandible. The first rib also include the trachea, thyroid cartilage, epiglottis, hyoid bone, mandible, ramus of mandible, mandibular notch, zygomatic arc, and the sphenoid bone. These are the parts of the general anatomy of the neck. Also in the neck, we can find the cervical spinal cord. As we can see on the picture of the cross-section of the neck at the level of the 6th cervical, we have the recurrent laryngeal nerve, sternocleidomastoid muscle, sternohyoid muscle, sternohyoid muscle, platysma omohyoid muscle, longocervixes muscle, scalenus anterior muscle, scalenus medius muscle, spinal part of accessory nerve, the trapezius levator scapulae muscle, splenius capitis, semispinal capitis, ligamentum nottae, the spinal nerve, vertebral artery, prevertebral layer of fascia, investing layer of fascia, sympathetic trunk, vagus nerve, common carotid artery, deep cervical lymph node, internal jugular vein, carotid sheath, thyroid gland, esophagus, trachea, and pretracheal fascia. So let's move on to the skin of the neck, which are the neutral lines. Cleavage of the skin are constant and run almost horizontal around the neck. In clinical terms, this is significant because an incision made along the cleavage. Greetings of joy, peace, and prosperity. We are now down to our next topic, which is the muscle of the neck. Before we get started, do you know that we have 26 muscles in our neck? To be more precise, we have 10 pairs of 2 and 2 sets of 3. Amazing, right? So now let's proceed. We have here our key neck muscles, and the first one is the sternocleidomastoid muscle. Maybe you are wondering how this muscle look like. This muscle appears as an oblique band crossing the side of the neck from the sternoclavicular joint to the mastoid process of the skull when it contracts. The skin, fascia, the platysma muscle, and the external jugular vein were the ones that cover it superficially. Lastly, this muscle divides the neck into 2 anterior and posterior triangles. The anterior triangle is found above the body of the mandible and posterior by the sternocleidomastoid muscle and anterior by the midline. It is further subdivided into the carotid triangle, the digastric triangle, the submental triangle, and the muscular triangle. The carotid arteries and internal jugular vein and deep cervical lymph nodes were covered by the anterior border, where it also overlaps the thyroid gland. Here is a photo of the anterior triangle of the neck for better visualization. On the other hand, the posterior triangle is bounded posteriorly by the trapezius muscle, anteriorly by the sternocleidomastoid muscle, and inferiorly by the clavicle. The posterior triangle of the neck is further subdivided by the inferior belly of the omohyoid muscle into a large occipital triangle above and small supraclavicular triangle below. Deep surface of the posterior border is related to the cervical plexus of nerves, the phrenic nerve, and the upper part of the brachial plexus. So here is a photo of the posterior triangle from the vertebral column to the first rib. Here is a photo for a better visualization. This is how the scalenus anterior muscle looks like. Another important information that needs to be justified are its relation anteriorly, posteriorly, medially, and laterally. First, talking about its relation anteriorly. It is related to the carotid arteries, the vagus nerve, the internal jugular vein, and
major superficial veins of the neck. In the picture, we see the posterior auricular vein, the posterior external jugular vein, transverse cervical vein, suprascapular vein, jugular arch, anterior jugular vein, facial vein, and the retromandibular vein. This is all part of the major superficial veins of the face and neck. So this is the prevertebral region and the root of the neck. First, we see the basilar part of occipital bone, longus capitis, mastoid process, transverse process of atlas, vertebral artery, scalenus medius, longus cervicis, phrenic nerve, esophagus, inferior thyroid artery, upper trunk of brachial plexus, thoracic duct, superficial cervical artery, thyrocervical trunk, suprascapular artery, scalenus anterior, third part of subclavian artery, external jugular vein, subclavian vein, internal thoracic artery, internal jugular vein, left recurrent laryngeal nerve, trachea, sternothyroid, sternohyoid, vagus, right brachiocephalic vein, phrenic nerve, right recurrent laryngeal nerve, cervical pleura, vertebral artery, costocervical trunk, inferior cervical sympathetic ganglion, upper trunk of brachial plexus, and the middle cervical sympathetic ganglion, supraclavicular nerves, transverse cutaneous nerves, the great auricular nerve, lesser occipital nerve, then the levator scapulae. So this is the brachial plexus and its branches, which is part in the prevertebral region and root. So we first see the dorsal scapular nerve, the nerve to subliclavius, suprascapular nerve, lateral pectoral nerve, thoradorsal nerve, musculocutaneous nerve, ciliary nerve, radial nerve, median nerve, ulnar, medial cutaneous nerve, and the medial pectoral nerve, and this is the upper and lower scapular nerve, long thoracic nerve, T1, 8, 7, 6, and 5.
Extrinsic muscle of the tongue. By the way, what is the extrinsic muscle of the tongue? Muscles are a group of 4 tongue muscles. They are all emerged from outside the tongue, in contrast to the intrinsic tongue muscles, which are totally contained within the mouth and have no exterior attachments. The innervation of the extrinsic muscle of the tongue found anteriorly. Sensory innervation of the extrinsic muscle of the tongue. The anterior 2/3 are supplied by the lingual nerve branch of of mandibular division of the trigeminal nerve and the chorda tympani branch of the facial nerve. The posterior third is supplied by the glossopharyngeal nerve. The blood supply of the extrinsic muscle of the tongue is in the lingual artery. The tonsillar branch of the facial artery and the ascending pharyngeal artery supply the tongue.
This is the distribution of the glossopharyngeal nerve. First, we can see the parotid salivary gland, then the otic ganglion tympanic branch, the lesser petrosal nerve, tympanic plexus, rotlets of glossopharyngeal nerve, superior and inferior sensory ganglia, internal carotid artery, external carotid artery, stylopharyngeus, soft palate, tonsillar branches, lingual branches of the posterior third of the tongue. The next one is the carotid sinus nerve, carotid body, carotid sinus, common carotid artery, and the pharyngeal branch. This is all the part of the distribution of glossopharyngeal nerve, which is part of the intrinsic muscles of the tongue. Extrinsic muscles of the tongue, sensory innervation. Anterior 2/3 of the tongue came from the lingual nerve branch of mandibular division of the trigeminal nerve, general sensation, and chorda tympani branch of the facial nerve is to taste. Posterior third glossopharyngeal nerve is the general sensation of taste and sensation. The lingual artery, the tonsillar branch of the facial artery, and the ascending pharyngeal artery supply the tongue. The veins drain into the internal jugular vein. Let's go to the palate. So what is palate? The palate is the roof of the mouth that separates the oral and nasal chambers and vertebrae. It is composed of a bony front hard palate and a soft posterior palate and has no skeletal support and ends in fleshy elongated projection termed the uvula. So this is the palate. This is the soft palate and the hard palate in the mouth. Okay, let's proceed to the innervation of the palate, the general sensory, which is located at the maxillary. So the innervation of the palate is the general sensory, which is the maxillary nerve via greater and lesser palatine. Nerves and nasophalyteal nerve, taste sensation, which is the facial nerve via greater petrosal nerve, and the motor is a vagus nerve and mandibular nerve. And then the blood supply of the palate is in the greater palatine branch of the maxillary artery, the ascending palatine branch of the facial artery, and the ascending pharyngeal artery. Now in the esophagus, larynx, and glands. So, we need to tackle the esophagus first. Have you wondered what is an esophagus? The esophagus connects the throat to the stomach and is a hollow muscular tube. So the innervation of the esophagus is the esophageal nervous plexus, and of course, its blood came from the arteries of the esophagus in the neck are derived from the inferior thyroid arteries. The veins drain into the inferior thyroid veins. So let's go to the nasal cavity. General innervation came from the septum and lateral walls is delivered by the nasopalatine nerve and the nasolary nerve, which is part of the ophthalmic nerve. Innervation to the external skin of the nose is supplied by the trigeminal nerve. The blood supply of the nasal cavity is the arterial supply to the nasal cavities from the branches of maxillary artery. Let's go to the larynx. The innervation of larynx came from the vagus nerve, superior laryngeal nerve, internal and external inferior laryngeal nerves. The blood supply of larynx is the first upper half of the larynx came from the suprathyroid artery and the lower half came from the inferior thyroid artery. Thyroid. Thyroid gland is a butterfly-shaped organ located in the base of the neck. It releases hormones that control metabolism, the way your body uses energy. For the innervation of the thyroid gland, it is called the cervical ganglion, sympathetic, and the recurrent laryngeal nerve, parasympathetic. The blood supply is the superior thyroid artery, the inferior thyroid artery, and sometimes the thyroidea. So this is the picture of thyroid. This is the blood supply and the venous drainage of the thyroid gland. This is the cresothyroid muscle, the crescent cartilage, inferior thyroid vein, left brachiocephalic vein, trachea, esophagus, thyroidea artery, middle thyroid vein, lobe of the thyroid gland, isthmus of the thyroid gland, common carotid artery, superior thyroid vein, superior thyroid artery, internal jugular vein, pyramidal lobe, thyroid cartilage, and the levator glanule of thyroidea. The last topic we have is the parathyroid. Parathyroid is a gland that has 4 small glands of the endocrine system which regulate the calcium in our bodies. Its innervation is located at the superior or middle cervical sympathetic ganglia. Its blood or arterial supply came from the superior and inferior thyroid arteries. The venous drainage is into the superior, middle, and inferior thyroid veins.